climate change means that neglected diseases are going to be at the forefront, and how they are managed, which is frankly poor.
Welcome to The Conversation. On today's episode of Trailblazers, Johnny is speaking to Elena Mills, healthcare communicator and co-founder of the Salve. We hope you enjoy the episode and be sure to subscribe.
Elena, lovely to have you.
Thank you very much for having me. Great to be here.
How does your 2024 find you?
Oh, it's, really good. 2023 was interesting, our second year in business. So, we're just hoping 2024 carries on the way we've started.
Interesting. You founded the Salve 2 years ago, obviously, but last year, I know it was a big milestone. You achieved your B-Corp status. How's that journey been?
We did. That was a 2-year journey because we started that. We always had the intention of going for B-Corp status right from inception. And July 2023, we achieved B-Corp. It is a long journey. There's actually a lot of people wanting to be B-Corps now, so they have a bit of a backlog. You have to just wait your turn to be assessed. But as a business, as a startup, the B-Corp framework is brilliant because it tells you exactly how to set up and run a good business. That's so helpful for a startup. So we just spent our time preparing, putting in place everything we needed to achieve B-Corp status, and then awarded that in July. So we're super
incredible.
Pleased.
Congratulations.
Thank
I
you.
guess, as you say, it's a really nice process to go through because it's laying the foundations for the way in which you want to run the company on a longer term basis. So all of those exercises that you go through, what's our mission, vision, values, all of that sort of stuff, it just
every part of it is grounded in the B-Corp movement, and it taught us things we knew how to run a business, but it really embeds all the processes and the framework to do it properly. So from people, governance, environment, social impact, community, everything.
So for people that may not know, do you want to give us a little bit of background as to your background and the Salve and what the work that it is that you're doing?
Yeah. So my background, a life sciences background. I did a PhD in molecular biology and biochemistry, and went on to be a medical writer. So I knew I didn't want to be a scientist, and an opportunity arose in a little medcoms agency as soon as I'd finished my PhD. And I spent about 15 years working in an agency, moved over to client services. I just found my niche in kind of people and managing and operational, the operational side of things. And then you kind of get to a point in your career, I think, where you feel like you need something more, and I felt like I wasn't really progressing in the agencies that I was in. I wanted something more. I wanted to do my own thing. So I was very lucky. Had a lovely friend, Liz Salve, who's now my co-founder. We'd always worked in the same agency, and we talked about setting up an agency for sort of 5 years before we actually made the leap. So we left. It was really the pandemic that kind of.
I was going to say, what was the final?
That was
push.
Really the final push. People were working from home. We'd always wanted to run a remote agency because we felt that was helpful for people at our stage of life, maybe with young families who were trying to juggle employment and family life. And it just seemed like a really great time because the people we would want to work for us would then be set up well for working remotely. So it was just all the stars aligned, and we made the leap in 2020. So
incredible.
Really nice to be here and running my own thing.
I mean, it's a journey, isn't it? And it's
totally
one of those things that I think you take that leap and then you realise, wow, this comes with a whole new set of challenges that I get to embrace and get to enjoy. But it sounds like you've approached things in a way that you had a very clear vision as to what you wanted to achieve, and you're working towards that, obviously with the B-Corp status as well, and how you've laid things out, and creating an agency that you would want to have worked for is a huge thing as well.
Yeah, absolutely. So one of the main things that Liz and I wanted to achieve was more pro bono work for agencies. That wasn't something that we'd had the opportunity to do. It wasn't really in the vision of the companies that we'd been working for. But medcoms professionals, the people who work in medcoms, have a really unique set of skills. And while medcoms has always had a tradition of giving to charities, so it might be sponsored runs, baking, we really felt there was a need for using people's skills directly, their actual medcom skills. So that fit very well with the B-Corp movement. And social impact is a really important part of that. And so 10% of our time and effort goes into pro bono partnerships with not-for-profit health organisations. And we've partnered with an organisation called the Passion Partnership, run by Jenny Talman, who pairs agencies with not-for-profit organisations. So she is one to watch, I think, because she has a vision that she wants all agencies really to have a pro bono strategy embedded by 2025, which we're totally behind. We love that.
Yeah, I think that's fantastic. And it's one of those things, as you say, giving money is one thing. It's sort of equivalent of giving a voucher at Christmas.
Yeah,
I
and
suppose.
we still do that.
And
we still do, donations.
But where you actually add even more value is obviously, as you say, the ability to share your skills.
Yes,
and the
absolutely.
ability to actually create that impact on a further scale.
Yeah.
With obviously the passion that you have for that as well, I know another area of passion you have is in neglected diseases and stuff like that.
Absolutely.
Talk to us a little bit about that, where that came from, and even what neglected diseases actually are for those that may not know at home.
So my PhD was in a neglected disease. I didn't know much about neglected diseases before I started my PhD. My PhD was in leishmaniasis and trypanosomiasis, and they're single-celled organisms that cause disease, mainly in Africa and South America and India. They are used in biology as model organisms for immunology. So that's where I came into it, because I wanted to do molecular biology and immunology, of which leishmania is a model organism. And then when I started, I realised what it is that those disease cause in the field. And it's a huge burden of disease for low-income populations in developing countries. There's 1 million fresh infections of leishmania a year still. And I really started looking into the treatments for those diseases and how they are managed, which is frankly poor. The pipeline for drugs for neglected diseases is low. The investment isn't there often. They're hard to reach populations. They're difficult to treat diseases. But there's a whole, if you look at neglected diseases as a whole, it's not just single-celled parasitic organisms. It can be helminths, bacteria, viruses, anywhere where there's just a lack of investment, treatment, capability on the ground to manage those diseases.
Yeah. And why is this something that you think we need to be more concerned to right now? I obviously have my suppositions as to what that might be, but why do you think there needs to be more of a horizon scan in terms of an awareness of these neglected diseases?
I mean, it's not just that it's the right thing to do. As a global population, we have to look after the most vulnerable, and treating populations with neglected disease is really important. On top of that, climate change means that neglected diseases are going to be at the forefront. So the vectors that transmit organisms like leishmania and trypanosomiasis are going to be moving north as our climate changes, and that will be pushing it into populations that are first world, and it will become first world disease. So we do really need to be looking ahead into the future, to be looking at how climate is going to be affecting those diseases. Where is the spread of the vectors? How are those going to be transmitted in the future? And the changing profile of those diseases in populations. So, I mean, leishmania is already endemic in places like the Mediterranean. You are at risk if you go on holiday there, potentially. there's not a lot of chance that we'd find those vectors in the UK. We've still got a climate that's too cold and probably would still be too cold even in 50 years. But France and southern Germany, those kind of places are going to find more prevalence of these diseases as we go through.
So what sort of action would you like to see on tackling some of these, historically neglected diseases? What can we be pressing for and do to stimulate some change?
So there's already some really good examples of industry and provider partnerships. So the Drugs for Neglected Diseases Initiative is one organisation that was created in 2009. They've got a really interesting model where they take pharmaceuticals that already exist and scan them for activity in neglected diseases, and that has really supported the pipeline of drugs in tropical diseases coming through. So there's fexinidazole, which is the first oral treatment for trypanosomiasis. That's been a game changer. Previously, like you said, the drugs are awful to take and sometimes cause, fatalities in and of itself. So I would love to see more industry, not-for-profit partnership. And if you take something like the B-Corp movement, that would be inherent. And actually, you would be building part of your measure of your business success from your social impact rather than just your profit, your bottom line. So I think, pharmaceutical companies do have a responsibility to be looking at their drug candidates and having an eye on testing those in neglected diseases. And because it has been shown that some of the candidate drugs have alternate activity in neglected diseases, and we can use that and we can leverage it.
That's so interesting that there's cross-applicability between a formulation that might treat one disease or condition and that applicability in neglected diseases.
Yeah, absolutely. There's one, eflornithine. It's really interesting. It's actually used to stop hair growth. Also has activity in leishmania, and it's to stop a cell cycle. So if you've got rapidly growing hair cells, it's actually the same kind of cellular machinery as a rapidly growing leishmania cell. So so that drug has dual activity, but you wouldn't put those two things together at all.
That's so interesting. Hair growth,
I know.
leishmania.
It's crazy.
Yes.
But so you just have to scan these drugs for activity, and obviously those candidates shown to have activity can be taken forward, but that requires the time and the skills, and people like DNDi are doing that.
So for people that may not know, how are these diseases usually transmitted in people? So
for leishmania and trypanosomiasis, it's SAM flies for leishmania, tsetse flies for trypanosomiasis. There's also another kind in South America, Trypanosoma cruzi, which is a really nasty disease, is transmitted by triatamine bugs, or reduvid bugs they're also called. So different methods, usually an insect vector, but characteristically there's usually kind of a latent phase, so you get initial infection, and then for T. cruzi, for example, it could be 20-30 years before. Some people will have no ill effects, but 20 to 30% will develop heart problems, esophageal inflammation, and it is a terminal disease. They're really horrible. Part of the reason I think they are not well profiled is the initial infection isn't kind of correlated with the end morbidity, because the time frame has been so long. So it's really hard to get a handle on how prevalent these diseases are and what morbidity they're causing. Yeah, and I think something that you touched on previously whilst we've had conversations is, because of your immunology background, the way that they actually mirror or they're actually quite insidious in the way that they act in the body. Yes, they do. So leishmania hides in immune cells, and it can stay there and be very silent for quite a while. And that's why they're so difficult to treat, because they're intracellular parasites.
So with pharma, we've got a potential that they might be able to, look at some of the current formulations that they have that might have that cross applicability. Yeah. Are there any other levers that we might be able to pull in terms of tackling these neglected diseases?
It's not just pharmaceuticals. So we're a medical education company, and we exist to support healthcare professionals with learning. And the same could be said for neglected diseases. So, education on the ground is really important. So my supervisor from Imperial College for my PhD, Helen Price at Keele, is involved in a really interesting project called Eclipse, and that is helping patient education on the ground. There's a lot of stigma with those diseases. Often they're very disfiguring, and there's a lot of shame. People don't come forward for treatment, so there's a lot of medical education on the ground that can be done as well. And that, again, is something that requires funding, could be funded by industry as well. Looking at those other levers that you can pull is super important.
Yeah, education, I think, in all aspects is one of those, it's one of the biggest levers that you can pull, because the more educated you are about something, the more opportunity that you have, and then the greater the awareness, right? And that's one of the things that I think, at least, as we were saying off camera, we have in our societies, we often have these diseases or conditions that are probably the burden of the privilege of age, I suppose, that we get. Yeah. However, these are conditions that so often go unreported on, and yet they are going to be coming our way because of factors like climate change and things like that we need to be more cognizant of and more aware of.
And even, the effect of climate change on what are traditionally first world diseases. So, pharma companies really need to be doing that horizon scanning now. How is climate change going to be changing the profile of disease in Europe or the US? And I can think of chronic disease like asthma or diabetes. How is climate change going to be changing people's disease profile, the trajectory of disease, the way people take the medicines? Is that going to be affected? There are a whole range of things that I think need looking at, preparing for, and building into medical strategy.
It's funny that something doesn't become a problem until it's like banging on your door often, and that seems like that's sort of what's happening with this, where it's going to be until there is such a sufficient demand to respond to the need, it's probably going to just be something that I'm sure that there is some work being done somewhere by someone. Yeah. And who's like, guys, we probably should be paying some attention to this, but actually, until it gets to a point where it's, the bottom line would justify this.
Yeah, absolutely.
It's one of those that it goes a little bit uninvestigated in the long. Yeah.
But I mean, there is a lot that can be done in terms of looking at disease profile, mapping it against geographical change, perhaps. Is it going to be worse with temperature increases? So I think there is a lot of research that can be done to extrapolate scenarios in the future. So scenario planning, horizon planning, and then preparation for how that might change a drug profile.
Is there applicability with some of this research, if it's more is invested in this regard and more is put towards that we might even actually be able to investigate further or identify other downstream genetic diseases and things that might actually jump from one animal population to another? Obviously, we've just had the pandemic in 2020 from COVID. Is there more that might be identified through that work, or other opportunities that we might explore and find through a little bit more investment in those places?
So one of the key things that can be done is just better surveillance. There's a few ex-colleagues from my lab who are still involved in neglected diseases, And that is the key message from some of the neglected diseases conferences, that we need better surveillance. We can't plan for the future unless we know what's happening where, tracking those vectors, where they're going, mapping where they might go in the future. So yes, surveillance is a really key part of it.
Yeah, it actually falls into something that I heard recently, and it's really funny that it seems to have cross applicability across a number of different domains: analyze, communicate, execute. And I heard that lovely little ACE framework, and that sounds very much like what we're looking for now.
Yeah.
It's the analysis and surveillance of the current situation, the communication as to why this problem is such a problem and what needs to be done about it, and then it's the execution, which is the funding, the education, and then action to look at some of these molecules that might have applicability across with these things.
Yeah,
are there any other
absolutely.
areas that you're particularly excited about, or that you're within your work day to day that you're kind of like really getting you excited?
So one of the lovely things about running your own business is you can kind of put your focus on your areas of passion, and mine is clinical unmet need, essentially. So neglected diseases is one. Women's health is another, where we see a gender health gap, a gender data gap. And the other one is rare disease. So those three areas, I think, are our focus. We think as medical communicators, we are kind of the halfway house between pharma and healthcare professionals, and there is a lot that we can do and consult on in terms of raising the profile of women's health, even down to just reanalyzing existing data for sex differences, for example, for different ways that women's bodies and men's bodies process drugs differently, tolerability profiles, efficacy differences. Those can be built into clinical trial planning, data analysis. And there are some really good guidelines, like the Sex and Gender Equity and Research Guidelines, which should be used by every medcoms agency and pharma when planning and reporting data. So just things like that, we have a real kind of focus on to drive in our industry.
That's really fantastic. What are some of the most common, unmet needs that you're seeing and trying to address with that work?
So it was really highlighted to me when I read Invisible Women, the book by Caroline Criado Perez, and there's a whole chapter on pharmaceuticals, which if you have time to have a read of it, it is a brilliant book.
Highly recommend.
Yeah. And so I read that and kind of took away what it was that I could support in our own medcoms agency for supporting women's health. So yeah, it will be things like tolerability differences, efficacy differences, again, more funding into areas that have traditionally not been prioritised. It might be menopause, it might be postnatal care, it might be fertility, you name it. There's always a lack of prioritisation and funding in traditionally women's health areas. So yeah, I'd love to see that change, and I think as medcoms agencies, and especially as we're a women-owned medcoms agency, that's somewhere where we can really support and make sure those areas are prioritised.
Yeah, I'd love to see that too. I think it's one of the, having had the conversation with Deb Evans a few weeks back before Christmas, and talking about her work within perimenopause and menopause, and then just a bit of a broader awareness on the subject matter. I think it's definitely an area that needs more attention and more investment in. I was seeing something the other day that really kind of blew my mind, where there was a lady that was going through very, very painful period problems, and basically got to the point where she was saying, I actually would like to have, I want everything gone. I don't want to have this anymore. And she got a psychological evaluation as to whether or not she would be okay to not be a mother.
Yeah.
But she's asking the doctor at the same time, well, do you ask a psychological evaluation for people that are going to be mothers as to whether or not they're fit? This is something that's going to impact my body, my health, my And so it highlights, that disparity in terms of, well, even when something is going wrong, is it being taken as seriously as it possibly could be?
Absolutely.
And so not only is it kind of an unmet need in terms of the actual treatment itself, but even the attitude towards the ways in which it's looked at is something that I would really like to see a massive step change in, because it is something that I think is, and as I say, this is from individuals that I know, this is pushed to the side an awful lot, and you're just kind of like, oh, you just got to toughen up, buttercup.
Yeah,
and it's like, well, hang on a minute here. There's a little bit more that's going on, and I think that's something that I'd like to see a lot more investment in, for sure.
Yeah.
And it would have a lot of benefit. We've got 50% of the population.
Yeah, it is crazy, isn't it? I think it starts even with things like venture capital investment, and at the moment it's only 1 or 2% of female founders or female focused businesses that are getting the VC investment even. So I think our whole investment environment needs to shift. We need to take these diseases of women's health seriously, invest in them, support the women who are building businesses that are trying to prioritise these kind of things. Things like endometriosis, hugely painful problem for a lot of people, and just been really poor investment and pipeline of treatments in the past.
Yeah, it really is. And it's something that, as you say, it has a huge impact on, and if you're living in pain and you're living with that reality every month, that's just, it's just agony. Yeah. And then you're told, it's all in your head. You just need to take some painkillers and get on with it. That's just not good enough.
And that's when, medical communications, medical education is super important, to just highlight those diseases. That is our bread and butter, to support healthcare professional knowledge of clinical trials coming through, disease awareness. And so that's why we want to work in that area specifically, where there's a clinical unmet need. And it is the most kind of fulfilling area to work in as well. We're very pleased to be working with some amazing clients who kind of share our vision, and so we hope it kind of goes from strength to strength.
Oh, I'm certain it will. In terms of, obviously, this is an area of massive impact that you could have. What are some of the other areas that you'd like to have an impact on, and that you'd like to see more education around as well, and where you think that we could all be, where we could make a greater degree of impact through the communication and education? I guess sometimes it can be difficult when we get a little bit of exposure to things. We all assume that something should be kind of common knowledge. What are some of these other areas that you'd like to draw a little bit more attention to as well?
It's amazing how things that you think should be common knowledge and aren't. So I think the prevention part of health is just largely overlooked. And, that's capitalism for you. That is, we try and treat things to make a profit with a pharmaceutical, but often actually there's a huge preventative part of that story as well. And I would love to see industry getting on board to prevent disease as well as trying to treat it. And things like postnatal mental health, if women were properly supported to learn how to care for their babies, for example, or to breastfeed, you might end up with fewer cases of postnatal mental health. But a lot of the focus is on treating mental health disorders after they've occurred, whereas really we just need to be supporting more women prenatally to make sure we've got a focus on both sides of the equation. So that's just an example of where I'd like to see prevention higher on the agenda as a kind of social responsibility.
I agree. I think that comes back to something that Tim Murdoch from the Cambridge Design Partnership was talking about, where tackling some of these bigger healthcare problems is going to look at systems thinking.
Yeah,
you need to look at things way more systematically and as an ecosystem as a whole, so that you can generate that positive impact. And as you say, it's about the preventative.
Yeah.
It's about empowerment at every stage of your healthcare journey, and looking at that not just through the lens of an acute condition that you're treating. Actually, it's your whole health span.
You're absolutely right. And part of our role as a consultancy is helping with that kind of healthcare transformation journey, and industry provider partnerships to support better patient care is also a real focus for us. And there have been examples of really great programs where healthcare journeys have been supported. So that might be getting more patients into secondary care instead of being stuck in primary care. How can we use healthcare comms to support that? So there are some pioneering projects going ahead, and I'd like to see that kind of healthcare transformation programme prioritised within pharma as part of their kind of value add. It's not just about pills to patients.
100%.
It's about what goes around that and making sure the patient journey is optimal as well.
And I think you've touched on something there that, we, in the UK, we are obviously very, very lucky with our NHS. And we do have somewhat of a social responsibility to not put an excess burden on that. So that hopefully would mean that we take some more positive choices with our own lifestyle choices. However, there is a challenge, obviously, with people even understanding some of the choices that they're making may not be downstream positive. But within that, you fold on the layer of, pharma and using the resources and the research and all the knowledge that they have in order to play a role in this, and realizing that actually, health is probably going to be the biggest societal challenge that we have in the future.
Absolutely.
We have an aging population. Whichever way you slice this particular onion, whatever you want to call it, the population, I think, of China is set to halve. South Korea, and you saw just recently in North Korea, Kim Jong-un holding back tears when he's imploring the country to have more children. And these are challenges that as an aging population, we need to be taking better care of ourselves. And the research that's available, not just to give, as you say, it's not just about pills or formulations or drugs. It's about, okay, well, how do you live a better life? What can you do to live a better standard of living that keeps you healthier for longer, that hopefully means that you also pass some of those positive habits down to the next generation so that they can play a positive role in this journey as well. And that will have much greater downstream, I'm one of those people that tends to believe that upfront investment will pay the dividends in the end.
We're all very short-termist though, aren't we? It's really...
Unfortunately, yeah.
So just trying to look at the bigger picture and, what are the levers you can pull for population health? It is down to investment though, I think. And you can see it in the pandemic, population health investment was deprioritised and we absolutely paid for it. So, yeah, where there are places that we can help with medcoms and medical education, we absolutely will. And that for us is part of our vision of business success. It's not just about the bottom line, it is about social impact. And that's actually where we found we are benefiting, because people want to work for us.
100%.
I think, and as you get older, I think you have a drive to make sure you are pushing back or paying it forward, whatever you want to call it, making sure you've had an impact in your working life. So if we can offer that for our staff, that's job done for me as well. I'd really like to provide a really meaningful, purposeful place to work where people can go home and think, yeah, I made a difference.
Yeah, I think that's what the majority of us seek. I'm sure that there's a small percentage that don't, but I think the majority of us do want to have an impact. We do want to feel good about the work that we're doing, and that it's leaving the world a somewhat better place than we found it.
Absolutely.
If someone wanted to find out a little bit more about that particular journey that obviously you've been on already, where are there any places that you'd recommend that they go, resources that they can look at, and things that they should be aware of to start that journey?
Yeah, I mean, I would point people towards the B-Corp website. So the B Impact Assessment, which is the assessment that any business can take. You don't have to pay for it. It's completely free. You can benchmark yourself against the B-Corp framework. It just signposts you to things that you might want to do in your business to improve it in all areas. And you don't have to be on the B-Corp journey to do that. So find out about it, have a look at what the Better Business movement is about. But I think that's where we should all be heading in terms of business operations. Amazing.
If you had a magic wand, I know this always starts you like thinking, oh God, what's he going to ask me now? If you had a magic wand, you could change one thing. It could be education, whatever it might be. What would you change in the understanding of the medical space, or an impact that could be had that you think would really start to move the needle towards more positive long-term health outcomes for patients?
I mean, the thing as a mother as well, and as a healthcare communicator, that I've really found, I would love to support women with breastfeeding. So I'm already a breastfeeding supporter. I've got a lot of time for those charities who are trying to support women, and there's no point saying breast is best if you're not supporting women with the skills to do it. So I'd love to see women supported from a population health perspective. It's got huge ramifications for reducing obesity, type 2 diabetes, and that's in the mothers and the babies. So I think if I could have a single population health lever that I could pull, it would be to support women with breastfeeding and pre and postnatal support.
Amazing.
Don't think I've said anything career limiting. Anyway.
No, it's always one of those things, and I'm always super mindful of it as well, because it's like, you don't want to go off on a tangent about.
No, I don't want to kill. I don't want to say pharma is bad, but
no, not at all.
At the same time, you want to go. Actually, guys, you want to be doing, and I want to be saying that. That is a kind of like the title of your podcast. You need trailblazers to be saying things that are perhaps not being said.
Yeah, because there's that wonderful meme that I've seen, and I think everyone's probably seen it. It's the thing at a festival. And it's a guy, and he's dancing on his own in this field of people just sitting around, and they're looking at the stage, and they're like, what's this guy doing? And then someone starts dancing next to him, or kind of like following along with him. And before you know it, the tidal wave of people that's brought up together, and they're all dancing, and we're all having a great time and enjoying it. And I kind of feel like that's what needs to happen within pharma a little bit.
Yeah.
I think there needs to be an understanding that, hey, we've got loads of resources that could be of massive positive benefit for patient populations outside of the formulations and the drugs that we and treatments that we make. We actually have a load of stuff that we can, take neglected diseases, like you said, the fact that you've got compounds and things that have been developed that actually are entirely to do with something else, like hair growth, that have this amazing impact in leishmania. Take something like rapamycin or metformin or these other things that are kind of treating diabetes, and they're showing applicability in longevity and stuff like that. And it's like, there is so much research, so much benefit. Like the cost to get a drug from molecule to market is like 2 billion, all told, by the time you get from point A to point B. 10 years, which is why obviously the COVID vaccination was such a game changer and so amazing, and proved the point of machine learning and using computers to help. But that still stands in terms of clinical trials, and the process that we go through completely still needs an overhaul. Burden of travel, we spoke about that. That's a massive challenge. 40% of people will drop out of a clinical trial if the place that they need to submit their samples is over 9 miles away. That's why there's other companies now trying to do work in terms of giving lateral flow tests or smart lateral flow tests, like electronic things that can send samples off. But there's so much in terms of research and stuff that they have. It's like you could just, from years and years worth of learning, just give that and help and do something that you might not directly monetize that, but it will have an impact. It will have so much wonderful impact for people. And don't get me wrong, you'll still make your money, but it's like, do you want to live in a world where literally everyone is just medicated?
Yeah.
And in some form or another, you know, we spoke about this as well, you know, you've got an old person on 7 different types of medication. Yeah. And some of those are just to balance out the effect of another medication. Exactly. And it's like you're playing this kind of like medicine Jenga. Yeah. And it's like...
That's why I love social media in terms of there's a real impact of clinicians who are coming onto social media and sharing their learning directly with the population. So there's a really great geriatrician that I follow called Elena Mills, and she has such a lot of good stuff to say about how to care for older people. It's quite technical. You need a level of kind of medical knowledge to understand it. But it's not outside the realms of possibility that the layperson can take this on board and understand it. So, yeah, I think where things like social media have really helped is, you know, clinicians sharing their knowledge directly with patients and patient empowerment.
And I think actually more clinicians need to do that.
I absolutely do.
I think, you know...
Her knowledge is absolutely golden. And we've all got elderly parents who are going to need to be cared for. And the more, you know, people like her are out there and saying, actually, this is what should happen, so you can recognise kind of poor care when you see it, is super important. So, yeah, making sure people are empowered and help themselves, I think.
100%. And it's the same thing with, you know... We keep hearing the refrain about misinformation or how do you tackle that? You tackle that by getting qualified professionals who have years of study and academic research and knowledge behind them to come forward. You may, in many cases, and I understand that there's a reticence for those people in some cases to put themselves forward. You know, social media, for all of its benefits, can be a very, you know, negative place, and people are always looking to tear down, because it's very difficult sometimes to offer something and easier to criticise. Yeah. However, in these situations, to tackle things like misinformation, to empower a patient populace that needs that, we're going to have to see that more, I think. We're going to have to see people stepping up and sharing the knowledge that they have and saying, you know, these are things that we need to be aware of. These are things that, you know, you should be looking at with regards to not just your health, your parents' health, your kids' health. Yeah. And all of these types of things are really, really important, because it's the only way that we dispel misinformation. And I think it's, you know, misinformation in an age where at the moment we are at a place where it's misinformation that's never been so believable.
Yeah, absolutely. And how, as a patient, how do you, or even just a layperson, how do you tell, you know, correct from incorrect? It's really, really difficult. We try and take a really human-centred approach to our comms. So at the moment we've done some primary research on how patients look for information. There was a big drive in medcoms recently for plain language summaries, which is a brilliant approach, where you're taking clinical trial data, publications, and making them accessible for patients. But there's absolutely no point in making a beautiful plain language summary if a patient can't find it, doesn't know if it exists, doesn't have the language for it. So we have been out and asked patients what they search for. Have they seen a plain language summary? Would they think to Google it? And our aim really is to make sure that that type of information that is coming through from pharma, their agencies are producing this kind of these activities, these assets, are actually searchable and findable by patients. And that might be supporting search engine optimization, but really going back and asking patients, what is it that they're looking for?
Yeah, and that's really important, because I think, completely to the point that we made earlier, we often make the dangerous assumption that something should be common knowledge, or that it's easily understandable and accessible. And actually, the role that we have to play is that simplification role. We need to boil things down to speak in plain language, because to frame this from our point of view, it's, simplify, amplify, ignite. You simplify something so that you can amplify the reach of that message. If you amplify the reach of it and the understanding, then someone can do something with that. You can ignite their passion to take a call to action. Yeah. And it's really, really crucial that that's the work that we're doing. And I think that that's something that is often overlooked, dangerously so. I won't use the exact expression, but we all know the expression, assumption is the mother of all beep-ups.
Yeah, exactly.
And that is...
And we have been working in an echo chamber, and just to take plain language summaries as an example, the pharma community and the medcoms community have been talking about PLSs for ages. The research to make them readable has been really good. But if people can't find them, it's absolutely all for naught. So yeah, we're really excited to be presenting that data next week at the
Amazing.
ISMAP
I was just going to say, when's that coming?
Yeah, we've got a poster abstract accepted at ISMAP next week. So yes, if you're there, come and have a look at it. And yeah, that's hopefully something that will benefit the whole medcoms and pharma industry, because they can take that research forward and build it into planning for plain language summaries.
Yeah, I'm sure it will be. It's something that we all need to be aware of. It's something that I think it's a watchword for everything that is going on in this area, because I do think as a general, we all are becoming a bit more health conscious. We're all very much aware that we need to be paying more attention to these things, and so we need to be empowering people to understand and to be able to take positive action from a level of understanding. And simplification of the messaging around that is the biggest part of that. So yeah, I definitely think it becomes, you're almost setting the bar through that.
Yeah, and I think the human-centered design process, which kind of was born in the product design world, is equally applicable to service design. So if we talk a lot about patient centricity, but it really has to be done well and take the principles of user-centered design, human-centered design, and apply it to the design of medical communications.
1000%. And that's actually really funny that you say that, because it's one of the things that I reflect on a lot, in that actually talking about Tim Murdoch earlier and the simple fact that you think about things as an ecosystem.
Absolutely.
Well, that is design thinking.
Yeah,
you think about, don't just try and tackle one myopic thing. You don't have this myopic lens of I gotta fix this thing. Well, if you try and fix that one thing, you don't tackle the whole picture, then that change will be really minimal. And in many cases it may not work because it's part of a flawed system that isn't designed to take that thing properly. Mo had this beautiful analogy previously where he talks about pockets of innovation happening, and then you have this fighter jet, all of this amazing technology, all of this amazing razzmatazz, and then trying to land it on a dirt track in the middle of nowhere. And that is sometimes what it feels like. And it's okay, we need to think about the infrastructure. How do we build the landing strip? How do we build the towers that are going to be there so that we can land it safely with the other airplanes that are going on in the sky? How do we make sure that we have the digital tools and things like that? All of this stuff that needs to be, and then also how do we have the roads that get the workers to the landing strip, and all of these things that you just, that's what we need. We need to employ some more design thinking, and it has been a real eye-opener that is something that, whilst I would have assumed was a very core part of any system that you were trying to build, seems to be somewhat lacking in medical systems and healthcare systems.
No, absolutely. And particularly in pharma, I think design thinking has a huge part to play in the design of innovative and useful and relevant comms. And I think we tend to be very guilty of, the launch wheels start to turn and we roll out the same old medical affairs assets. There's a huge amount we can do in terms of cross-functional team planning, innovation, using the design thinking process. So it's a really key part of our kind of strategy when we are talking to clients, that we're using a design thinking approach, and also pairing that with behavioural change theory. Those two things together are super powerful in developing some really innovative and relevant comms.
1,000%. And that comes back to, I think as well, you know, when we touched on it, it comes back to, you know, the simplification piece with those comms, because it creates that psychological safety. Because it's only through creating that where you feel maybe some agency and control that you're realistically going to take that action. You know, we're all obsessed with how do you create something that's going to drive a user behavior? Well, the first thing comes back to, does that person feel informed? Does that person feel safe in the decision that they make? Do they feel like they have some agency and control over the situation that they're involved in, that they understand the consequences that might happen downstream? Create that for them. And communications has a beautiful part to do that if we do it well and we do it right.
Yeah, and if we've asked the people who are going to
And
be
we
using it to feedback on whether they think that asset is going to be useful, or, you know, so part of the iteration and ideation and then iteration, I think, is super helpful. And I don't see that often in pharma, in medical affairs, but I think it's starting to happen. And yeah, as a consultancy, that's where we're kind of trying to head in terms of our planning and our support for our clients.
Yeah, I see it happening as well. It's still very much at a low level.
Yeah.
But I do see that it's funny how there's certain aspects of product design that are now becoming part for the course with.
Absolutely.
And part of that is actually testing, learning, iterating, you know, that agile methodology that, you know, becomes a core tenet and part of product design. Yeah. You know, okay, have we asked the user whether or not this is of service? Okay, what are the parts that they don't necessarily understand? Okay, let's revisit that and rework it. And you're constantly seeking that 1% marginal gain.
And the beauty of it, of course, is that your confidence in your end service or product or asset should be higher if you've tested it in a much more kind of prototype draft setting. You don't have to wait until it's perfect and rolled out, and I think we're quite guilty of that in
perfect
in
is
the
the enemy of done.
Yeah, absolutely. We just want something to be perfect, roll it out, but that's a very long-winded way of approaching innovation. So what I love about the kind of the design sprint methodology, it's like you say, it's agile, but it's also evidence-based, and return on investment, that's your golden, you know, that's what we're all searching for. So I think that's where design thinking can really help in medical affairs.
Yeah, and of course in situations where you guys come in, you've got that team that have that knowledge and expertise from medical affairs
and an objective viewpoint as well. That's where that's the beauty of having an agency on board with that kind of you know, additional view. And sometimes it takes you know, an outside perspective to create something that's really useful and relevant.
Yeah, well, that's the, you know, as you say, the outside perspective is one that really adds a lot of value, because I think sometimes it's the danger with knowing a subject matter so well and intimately that you get so far into the detail of something and into the weeds, you can't see the wood for the trees. And that different perspective is needed to be able to, even if it's maybe ill-informed in some cases, because that's the other thing. It doesn't mean that new perspective is inherently right. It just means that it makes you think about something a slightly different way. And sometimes that's all it takes to snap you out of the focus or thing that you're in, where you're like, oh, actually, okay, yeah, if I think about it like that, then this, and then this, and then the dots all start. Yeah. It's that catalyst that can often be required to create that change.
I do love that about the design sprint and the design thinking process, that it makes you think outside the box, and but in a very systematic way, so you almost can't miss anything. And for us as scientists, the design thinking process, if you pair it, especially if you're pairing it with behavioural change methodology, is a very systematic, evidence-based and comprehensive way of designing medical communications. And that's why we've really kind of tried to focus that and produce something that is usable and can be rolled out quickly with teams. So yeah, we're fully signed up to the design thinking process.
Scientific rigor to design outputs.
Absolutely. Couldn't have put it better myself.
Love that. Elena, this has been absolutely wonderful. Thank you so much.
Thank you so much for having me.
It's been an absolute pleasure. We've covered so much.
I know.
We're going to have to
the journey that we've been on in the conversation. Yeah, it's always a pleasure to chat.
Elena, if people want to find out more about yourself, the Salve, what you're up to, what they can expect from you next, where should they go?
Yeah, website, salvehealth.com, and we're very active on social channels. So yeah, look us up, see what we're doing. Yeah.
Elena, thank you so much. Thank you for tuning in. We really hope that you found this insightful as much as we did. If you'd like to like and subscribe wherever you're listening to or watching this, we would greatly appreciate it. And we'll hope to see you soon.